Vitals as follows. Age 71 years and 7 months at the time of the exam. Height 75 inches. Weight 239 pounds. Resting heart rate 68. Blood pressure 122/74. Pulse oximetry 99% on room air. Temperature was 98.4. Physical examination by system to include any studies that were done by system. Eyes, the president's uncorrected visual acuity is 20/30 bilaterally with corrected visual acuity of 20/20 bilaterally. His visual fields were normal. Fundoscopic exam was normal bilaterally. His intraocular pressures were normal, and no ocular pathology was discovered. Head, ears, nose, and throat, normal exam of the head, ears, nose, mouth, and throat. Dental exam, he has healthy teeth and gums. There were no other dental findings. Neck, normal thyroid exam, no noted lymphadenopathy. Auscultation of his carotid arteries were normal. Pulmonary exam, his lungs were clear to auscultation. A screening low-dose CT of the chest demonstrated no pulmonary pathology. Cardiac exam, heart exam was normal. Regular rhythm, no murmurs or other abnormal heart sounds were noted. His ECG, or commonly EKG, was normal sinus rhythm with a rate of 71, had a normal axis, and no other significant findings. He had a transthoracic echocardiogram done, which demonstrated normal left ventricular systolic function, an ejection fraction of 60 to 65%, normal left ventricular chamber size and wall thickness, no wall motion abnormalities. His right ventricle was normal. His atria were grossly normal, and all valves were normal. He had an exercise stress echocardiogram done, which demonstrated above average exercise capacity based on age and sex, and a normal heart rate, blood pressure, and cardiac output response to exercise. He had no evidence of ischemia, and his wall motion was normal in all images. Gastrointestinal exam. He had a normal exam, no masses, no hepatomegaly or splenomegaly. He had a normal optical colonoscopy done in 2013, June of 2013, that demonstrated no polyps or abnormal findings, and because of that, a repeat colonoscopy was not indicated at this time and will be deferred until his next periodic physical exam. Genitourinary exam was normal. Extremities and musculoskeletal, normal throughout. Full range of motion in all joints. He had strong distal pulses and good capillary refill in all extremities. He had no swelling or edema. Neurological exam, examination of the cranial nerves, cerebellar function, deep tendon reflexes, motor function, and sensory system were all normal. A cognitive screening exam using the Montreal Cognitive Assessment was normal with a score of 30/30. Dermatologic exam, normal, no evidence of melanoma, basal cell carcinoma, squamous cell carcinoma, or any other significant dermatologic diseases. I'm going to very briefly go over some of the labs here that I feel are most important, that most providers would be interested in, and then you can look at the details when I put out the written. But laboratory results summarized. A lipid panel, he had a total cholesterol of 223, triglycerides of 129, HDL of 67, an LDL cholesterol of 143, and his total cholesterol to HDL ratio is 3.3.